The number of Americans 12 and older who are fully vaccinated is just below 60% right now.
Joining us now with more insight on the pandemic and the push for this third shot is emergency medicine physician Dr. Ernest Wong with North Shore University Health System. Thanks for being with us tonight, Doctor.
Thanks, Ben. Thanks for having me.
All right, let's start with the importance of this booster shot. How important is it, and would this be the final blow in the pandemic in theory?
So it's hard to say right now if it's going to be the final blow because we're still in the thick of this wave. And I'm going to say I'm going to follow the guidance on this one because the news is preliminary, and I think following the CDC and the ACIP guidelines are going to tell me if I should get it at 8 months, which is coming up next month for me. So I'm anxious to know.
Okay, so, it took about 5 months or so to get the number of people vaccinated in the U.S. up to that 70% threshold, meaning herd immunity, or at least that's what they were hoping. How difficult do you think it's going to be to now get people to go back and get a third booster shot, get a third vaccine?
I think the people that are eligible for a third vaccine are not vaccine hesitant and not vaccine resistant. So those folks probably won't be as, it won't be hard to get them to get the vaccine. We really have to work on working with people that don't want the vaccine right now. That's a real big priority, and we still have to worry about that.
And who are you seeing in ERs with COVID-related illness these days? We keep hearing from Dr. Arwady in the city that 99.9% of hospitalizations are unvaccinated people. Has that been your experience?
Yeah, that's true. It's a real simple equation. Get the vaccine, you don't get hospitalized, and you live. Don't get the vaccine, you take your chances. So what we're seeing right now are younger people being hospitalized with severe illness because the Delta variant is more virulent than the original version.
Yeah, and it doesn't seem to be slowing down at all, which brings up this question of this third shot, this booster shot. For people that are thinking about it, maybe in the future, once it does get approved, if it gets approved, side effects of a third shot would be what?
I think that remains to be seen. I'm still waiting to see the guidance on, not only, the safety, which I think if it's recommended, I have no concerns about the safety and would be very happy to get it. My question is, will it do something to protect me more from hospitalization than just having 2 shots? So I think that's a big question for me, because if, let's say it doesn't, and we're better off vaccinating people that aren't vaccinated, because that'll be more effective at preventing continued transmission and potentially more variant development. That might be the better way to go, strategically. Right now, every patient that comes in that is vaccinated really is protected. And the people that come in that are unvaccinated really are at risk.
Illinois has been doing far better than many southern states, which have not only seen a spike in cases, but also in hospitalizations among kids. As an emergency physician, I wonder your thoughts here as we head back into school. There will be masks in schools, but how concerned are you?
First of all, masks work. All right, they work great, and kids in schools with masks can go to school and be safe. And I think that's the take-home message right now in our current state. I do worry a little bit about viruses that traditionally were winter viruses that are now we're seeing in summer, such as respiratory syncytial virus. We're seeing a lot of that, and the kids that are getting it can be quite ill. And so what's going to happen in the winter when all this is mixed together, I don't think we know. So that's something that I'm concerned about.
So you're seeing more of those respiratory issues rather than COVID issues as people walk into the emergency rooms?
Right. The consequence of us, having relaxed max mandates and getting together more often is all the other viruses that were kind of a little bit dormant are starting to pop up. And so that's kind of adding a little bit of complexity to the mix.
Yeah. Okay. Thank you so much, Dr. Ernest Wong with North Shore University Health System. We appreciate your time. Have a good night.
Thank you. Be well.